few people, the feeling that they are trapped in the wrong body can leave them in despair. Around 1 in 100,000 people are thought to suffer from a medical condition known as gender dysphoria, which you may understand better as transsexualism. For some, the diagnosis begins a long journey of treatment which can culminate in a sex change operation. We'll talk to some interested parties in just a second, but first let's hear a particular story. This is Mel's story, who's a transsexual living in Shoreham.
Well, I remember quite clearly that I was 5. At that time, we lived in Queen's Park in Brighton, and we moved when I was 6. And I remember before we moved houses that I realised my body was a boy's body, but it just felt wrong. And I realised also at that time that it was totally unacceptable for boys to want to be little girls, and so I buried it. I knew that I wasn't gay, and I didn't feel attracted to boys, and I didn't really feel attracted to girls either, you know. I just felt that I was a girl, and I suppose, I mean, one of the things that I've learned is that sexuality is very connected to context, so it's not unusual to not fancy boys if you have the body of a boy. You know, unless you're gay, of course, then it's a different thing. But I wasn't gay, and I knew that I wasn't gay. And at that time, of course, you know, I was trying to read as much as I could. And at that time, the sort of things that were in the magazines and articles were saying that transsexual people are gay men who can't accept that they're gay. Yeah, but I knew I wasn't gay. Confused? You will be. I used to belong to an adventure sports club, and I met my wife at that club, and we hit it off straight away, and over a period of time we fell in love. The gender stuff was still around, and I believed at that time that I could choose to be normal, if you like, because that was what I'd learned, and that was still being stressed. I mean, we're talking 15 odd years ago now. And so when we'd been going out for quite some time, I sort of thought, right, okay, I'm at this fork in the road now. I can either choose to be a normal heterosexual male with a wife and a marriage, or I can go the other way and transition into the woman that I believe I should have been. It was just impossible to go the other way. So I, you know, went and I proposed, and we got married. We love each other dearly, we still do. So I can't say it was wrong. I managed to keep myself very busy for a long time. And after I got my degree, I then kind of immersed in mountaineering, and I became quite a good rock climber. And like every weekend or every other weekend, I was off climbing and doing things during the week as well. I had a disc went on me in 1995, and I couldn't go climbing anymore. That enforced a bit of a rest. So I struggled and struggled and struggled to get back to fitness. I had an operation in 1996. I started training and working out to, you know, increase my muscle strength to support the back. My body started becoming quite a lot harder. It felt very, very, very uncomfortable and very wrong to be building up these huge, quite large muscles in my upper body. That's kind of, again, started to set off this little conflict. But I managed to get fit, and I managed to get climbing again. So I managed to start to make myself very busy again and keep it buried. Then another disc went in 1998. This had quite a big effect on me. I had what they call a drop foot. Climbing was definitely out, and keeping busy was definitely out. So because I couldn't keep myself busy, the feelings started to surface. It just became harder and harder and harder to deal with. Then about 2 years ago, I just couldn't pretend to myself anymore, and basically had a huge personal crisis. I spiraled very, very quickly down into depression. But I lost a lot of weight very quickly. Everybody could see that something serious was going on. That was when my wife said to me, well, she noticed obviously straight away. I was crying myself to sleep every night. And she said, look, for God's sake, tell me. Now, she knew that I cross-dressed from some years ago. And I just said to her, look, it's the gender thing. That was the first time I had told anybody. In some way, it was a release that she knew. But, of course, that then opened Pandora's box. Because, it immediately called into question the marriage, our relationship, the future, all of those things. We agreed that I was going to go and find help, and so I contacted the Gender Trust and said, unloaded onto Rosemary and was put in touch with a counsellor. That helped me through a couple of months, but it was still very difficult to deal with. I was still clinically depressed, suicidal. My wife said to me, look, for God's sake, you've got to go and see the doc. I had spent my whole life not telling the doctor in case there was a medical record of this. And 20, 35 years ago, whenever, that long ago, that kind of thing was a big black mark on your medical record, so I was scared that he would know. And I realised that, I just had to go and seek help. So that's what I did. I went down to the doc with my wife, told him, and I remember my exact words. I said to him, look, either I'm going to be the patient from hell or I'm going to be very interesting. It was scary as hell. It was necessary to get medication to help the depression. But, you're looking at 35 years of denial here, and it was as scary as hell that other people outside my wife knew about it. And it took a long, long time before I became a little blasé about it. I am now. People know me, they know I'm Mel. If they know I'm transsexual, I don't care. But back then, that was a big deal. Very big deal. Everybody focuses on the op. That obviously is an important part of it. Many people see that as being, a huge rite of passage, if you like. But it's a very, very long process before you get to that. The requirement for that is that they have to live full-time in role for at least a year before they can be referred for surgery. And, of course, during that period, they're undergoing hormone treatment. In my case, as a male-to-female transsexual, I'm taking female hormones. And, obviously, my body, I produce boobs. Fat redistributes away from the waist onto the hips. Skin changes, hair changes, that sort of thing. Then, after a period of time, the psychiatrist will refer you for surgery. Because I'm under Charing Cross, which is National Health, their rules are 2 years living in role. But that's National Health. And then you can be referred for surgery. So at the moment, I'm what in the gender community is called pre-op. But it doesn't stop me living my life. I don't get read as being female. Most people don't know what's going on in other people's trousers. And it's the same for me. For me, the thing with women is it's much more important to have the friendship and the companionship and the love and the togetherness and the closeness. And I suppose that's a very female view of the world. So, I don't walk down the street and look at fellas thinking, oh, fancy you, I don't do the same with women either. I tend to look at women in the same way other women do. I compare myself to them and think, God, I wish I had legs like that or hair like that, So to me, I have to get the difficult bit over, yeah? I have to be me, I have to be Mel, and then we'll sort out the other stuff later.
Mel's story there. Michael Acton is a counselling psychologist who specialises in the area of gender dysphoria, and he's in our London studio now. Hello, Michael.
Hello, Neil.
Hi, thanks for joining us. It's an interesting story. I don't suppose any of these are typical, but are there general themes in Mel's story there in the patients that you see?
Absolutely. I think Mel encapsulated beautifully the struggle with the denial, which is the first of the general 5 key points to transition. which can be obviously a nightmare if you can imagine somebody living with a chronic condition for 10, 20, 30, 50, sometimes 60 years. Of course, it has extreme negative byproducts.
Mm. How can you, as a psychologist, actually sort of identify the people who genuinely have a medical condition here and people who just think that they have that medical condition? Do you know what I mean?
Right. The Bible, the DSM-4, which psychologists use for diagnosing people's issues, really, it's not difficult to work with somebody and see whether this is something that's erotic or something that's actually gender dysphoria, i.e. a person that's in the wrong body. Mm-hmm. Historically, it's called Eonism, after Chevalier d'Eon de Beaumont, hence the name Beaumont Society, which is another transgendered group. But it was first mentioned in the early 1800s medically in psychiatry, and it's moved on since then to be sensationalised in the 1960s, which really brought it to the fore, mm-hmm. and created more critical research in the area, which now underpins today's treatments, of course.
And, I mean, how much do we know about this medically? Why someone could be a woman trapped inside a man's body? How can that happen?
Well, if I knew that, I'd be a millionaire. Unfortunately, there's no known etiology. There's some research at the moment into neuro tissues and cells, and but there's no concrete understanding of how this happens.
Yeah, as I understand it, and please correct me if I'm getting this wrong, is that a man's brain is slightly different to a woman's brain, and we now know more about the way the brain operates. Does that help medical people in diagnosing gender dysphoria? Are you able to just have a look at the brain?
Well, most neurologists who look at brains, then maybe they could explore this further. Unfortunately, when most people access help, it's to either a counsellor, a psychologist, a GP, or a psychiatrist. And of course, we're limited on our assessment criteria, and I don't think it would be the way forward to start testing people's brain tissue, really.
Right.
It would be quite extreme.
Okay. I just found the whole idea of perhaps, a physical test, you can actually do almost like a blood test, you know what I mean? That almost sort of clears up any sort of, I don't know, some thought from people who might be critical of this whole area and saying, well, actually, they're just making a fuss over nothing here. Do you know what I mean?
Well, if people are critical over people that are transgendered or with gender dysphoria, usually, this is not speaking for all, of course, there are individual cases, but usually it's a choice of death or transition. That's how serious this condition is. So, just thinking about that, I'm either going to die or I'm going to risk everything I know in my life at present to do something about this. It is quite significant. So I think if this were a trend or a fashion or some kind of other pathology, then I don't think a person would go to those extremes.
And what are the big challenges in coming to terms with a gender change for a person individually, not just their family, obviously, but for them?
Right. I'll be very quick, so I know we're time limited, but generally there are 5 key points to transition. Now, success isn't transitioning from one role to another, i.e. male to female, female to male. It's at what point the person can actually live with and cope with. Now, some people go all the way and have surgery and then continue with assimilation and different things after that. Some people are actually quite comfortable just actually assimilating themselves as much as possible without surgery, and some people say, well, okay, I've worked on that, and for many different reasons, it could be physiology, environment, varying needs within a person that would actually stop them going the full way. The 5 key points, just briefly, I call them the 5 Ds. The first one, Mel encapsulated brilliantly, and that's the denial and the repression stage. That's trying to ignore the dysphoria, using distraction. A lot of people become workaholics or depressed, create eating disorders, substance misuse, many different traumas. Some people, you know, just will be a brilliant academic and move into anything that will distract them from the issue, because it's so terrifying. All of society, all of our development, unfortunately, don't show transgender people in a positive light always. So obviously it's something to hide, especially with religion as the backdrop to our society. And generally at that stage there may be some mixed trials with cross-dressing and maybe behaving as the opposite gender, but that's the first stage, which is the most horrific, because it's a very lonely place for a person to be. And then the second stage is defeat, which is the pre-contemplative stage, where it's a battle. Like as Mel said, she had some problems with herself physiologically, so she couldn't keep up with her climbing, etc. So, I mean, that distraction was being taken away, and all of a sudden, you know, this couldn't be ignored anymore. I mean, she's crying in bed and things, she said to you. Calling helplines at that point, maybe hanging up before speaking because it's so terrifying, but actually just making that initial contact, knowing that there's something there, some other people there that may be experiencing this. Also at this second stage, people sometimes have suicidal ideation, thinking, well, I'm being defeated now, I can't live with this. Mass confusion, absolute mass confusion at this point. And generally around that second stage is the feeling of danger, of bursting, of letting out this dangerous thing that's been kept quiet for so long.
I mean, we're going to talk some more, and maybe we'll mention the other 3Ds when we speak to Rosemary in a couple of seconds after our travel news. But for the time being, Michael, it's a fascinating area, and thank you so much for your time this morning.
You're welcome.
Very good of you to join us. There's psychologist Michael Acton then.